When I'm thinking about the budget challenge and what Senator Bartlett says is true, this is a serious challenge we're facing as a state. I know that I will bring to the table as governor some of my, first of all, my recognition that the way we get out of this hole is get people working again. So my number one priority when I'm looking at the budget is how do we spend our tax dollars in a way that helps jumpstart job growth. That's going to be number one, because once people are working, there's tax revenues, and it'll be easier to fund our programs. The other piece is we want to make sure that we have strong communities. I mean, that's why Vermont is a great place to live. That's why we're a leader in community-based mental health services. That's why we're the envy of the country when it comes to deinstitutionalization and our success. So we cannot back off from those commitments. When I'm taking a look at where do we make cuts, because there's going to have to be cuts, I'm going to look at for waste first. I mean, one example in my own office is a year and a half ago we took over an agency, a department that was under the governor's office. It was the Public Records Division. And doing our analysis of, what are we doing and why, we found a whole department, 9 people doing work that was completely outdated, probably for 12 years. There were microfilming records. Now, if you think about it, our records are all digital now. But no one ever asked why. Why do we keep doing that? And so the first thing I'll do when I'm governor is have my managers ask the question why every step of the way. That was millions of dollars of waste. When we have real needs out in our communities, we can't afford to waste a single dollar. That's what.
And I'm going to give you my 2 values as we look at these tough budgets. The first is I'm going to work with all of you as partners when I'm governor. I believe that the best way to find efficiencies in this system, and there's no doubt that we have to find better ways of delivering services, but the best way is to work from the bottom up. People who are actually dealing with consumers, dealing with their clients, rather than a top-down approach, which I believe is what we have right now. And the second value, and I feel this very, very strongly and passionately, is we're going to prevent damage to people and our community-based system. That, to me, is essential as we go forward with this. And I'm going to tell you that I believe that we need a balanced approach to budgeting. And I believe I'm the only one up here who's been willing to go out there and say, use rainy day funds if we need them, and use additional revenues if we need them too. And that's somewhat politically risky, but I think it's important that we talk about it. That's the way we've dealt with these issues in the past, and that's the way we have to deal with them going forward. We may get more federal money, and I hope that we do get that federal money, and it may make that part of my discussion something that's not necessary. But I'm willing to go out there publicly and say that's an expression of my values. I think it's an expression of Vermont's values, that we don't leave people in the lurch when we're having tough times. And I believe that some of these proposed cuts are going to leave our economy weaker and are going to leave us weaker as a society if we actually go through with those cuts. And an example of that is the research that was done by the legislature's economists at my request as chair of the Senate Health and Welfare Committee, talking about all the federal money that we might be sending back if we make these general fund cuts, and the impacts on our overall Vermont economy. Over 1,000 jobs. It's not your jobs, it's the jobs that ripple through when you send $25 million back to the federal government. That leaves us in a weaker position when we get out of this recession.
Thank you, Senator.
I don't believe that we should be.
As governor, one of my top priorities, understanding the constraints of the budget, is going to be to bring together the people in this room and across Vermont, the folks who are providing mental health services, substance abuse services, law enforcement, remedial education, and others, and attack the biggest problem in our state budget, which is one of the reasons that community-based service is being cut. The second biggest area of growth in the state budget right now is corrections. Vermont has more prisoners, non-violent prisoners, locked up than any other state in the country. It's the biggest area of growth in our state budget. As governor, I'm going to reorganize that very aggressively, and it will be controversial, but we will do it because I get tough things done, to ensure that we stop that phenomenon, we reduce that growth, and we use those dollars to support the community-based system that Vermont has been so proud of. How are we going to do it? And let me tell you where this comes from. I am a family member that I went to AA with right here in Burlington about 6 months ago. At that AA meeting, there were 3 people that got up to talk about their issues. 2 of them got up, young men who have children, who have substance abuse issues, obviously, and who have been clean for a year and a half, are back in the workforce, are making child support payments to their children. And guess what? They were being sent to prison in Vermont in the next 6 weeks for offenses, nonviolent offenses that they had committed to feed their substance abuse habits. That's the choice we're making as a state. So what will I do? I will ensure that instead of spending $40,000 to $70,000 a year locking those folks up, we have the most aggressive, thoughtful mental health delivery system, substance abuse treatment system, education system to get these folks back in the workforce, prevention programs, and then we utilize those dollars saved so that we don't have to slash and burn our community-based system, which is what the Douglas Duty team has been doing. Thank you.
I'm running for governor because I actually have figured out how to solve the financial problems of this state and deliver good services. And it centers around correction, substance abuse, and mental health issues. And in appropriations for several years, we've been saying, do this, and this saves money that we aren't spending in corrections, and let's build transitional housing in the community, let's do more with mental health services. And there's a big bill that the Senate has just passed that does that same sort of thing by saving and not putting these as many folks in, allowing some non-violent offenders out. It generates $4.8 million, and we're going to reinvest some of that in the community. Part of the problem is, I believe that what we need right now is to make a significant investment in the support systems in the community, so that folks will be comfortable either not putting in people in corrections in the first place or allowing nonviolent folks to come out of corrections early. To do that, and unfortunately I think the federal government is riding in on a white horse for us, there's going to be some money that will allow a new governor to make investments directly into the system so that we can get people out of corrections, have them get the help they need, stop people from going into corrections by getting the help that they need, and have communities comfortable with this because the support systems will be in place to have everybody feel safe. If we do that for several years, we will literally save millions and millions of dollars, which can continue to be reinvested in you folks. Thanks.
Transparency. Transparency is knowing what it is that is going on in your government, how dollars are being expended, and what is expected of those who are given those resources. When I hear the questions about the challenges for change process, and I hear questions about what's going on in with state employees at the state hospital, and when I hear from people who are consumers, what I hear is a loss of trust. It's a loss of trust that the decisions that are being made in a framework that makes sense and for reasons that are in the best interest of individuals. You also have a situation where organizations like community mental health centers don't know the goals that they are being asked to achieve out of the cuts that they are being told they have to make. We absolutely have to, as a state government, be clear on what are our goals, what are our objectives, what works and what doesn't, and then how are we achieving or not achieving those goals once we actually go to implement them. When I was the head of AmeriCorps Vista, we did transformational work with 6,000 people and nonprofit organizations, not by blaming federal employees for the problems or the nonprofit partners, but by saying, we will put incentives on the table if you achieve these goals that we know will make our program more efficient and more effective. And we got incredible numbers of people to step up and to make a difference. The second is social return on investment, to make sure that we all know what it means to put a dollar in, what we're looking to get out, which will serve the organizations here incredibly well compared to other parts of state government. And finally, we need to make sure that we do not take out on the most vulnerable the fiscal problems of the moment.